Okay, glucose testing. For which conditions do we test glucose? That means when there is what? Expectation of what? A higher or an increase in the blood glucose level. Okay, especially that's in diabetes. So what are some symptoms of diabetes? For frequent testing, thirsty, frequent urination, fatigue, tiredness, okay, lightheadedness. All of these are what? Some signs of glucose. So what is the function of glucose in our body? What is the use of glucose? Glucose is important as what? As an energy source. Yes? So glucose is important as an energy source. So what is the most important energy of our body? What is the most important energy of our body?
ATP.
ATP. It's called ATP. Or your biochemist is? Yeah. Adenosine triphosphate. Adenosine triphosphate. Okay, what's happening is that this ATP, okay, is important for energy, like what? It's being degraded into what we call ADP, and there is what we call inorganic phosphate. Yes, inorganic phosphate, or which is called, okay, so that the energy is being used by the cells. Okay, so that energy is used for many functions in our body. For example, it can stimulate what? Contraction of our muscles. Let's say we have the muscles need to contract. Yes? Okay, the muscles will produce what? ATP. Okay, so that ATP is the one that's being hydrolyzed, and then it will be converted into ADP and inorganic phosphate, and energy will be released, and that energy is used by the cells. Okay? Just let me mention some things. How do we test glucose? One, we have fasting blood sugar, okay, which is tested when someone is what? Fasting. How long do you need to fast? Like 8 to 12 hours. 8 to 12 hours fast, that's called fasting. The other is what we call random blood sugar. Random blood sugar, that means just you go randomly and then you test. That's called random blood sugar. The other is what we call OGTT, which is called oral glucose tolerance test. Oral glucose tolerance. For what? For which condition do you use usually this one? Pregnancy. So it's called GDM, or gestational diabetes mellitus. Gestational diabetes. Okay, it means the patient has diabetes just because of the pregnancy. She didn't have like before. And when the pregnancy lasts, then what will happen? The blood sugar will be normal, okay? But in some cases, it might stay for life, so, okay? So that is what we call OGTT, or oral glucose tolerance. So that's what this one is especially talking. That means you will be given some amount of what glucose to drink, and then your glucose will be tested serially, which is called 3-hour blood glucose tolerance test. Okay, that means the first 30 minutes, then an hour, then 2 hours, then 3 hours test will be done. Okay, that is what we call OGTT. And the other is what we call hemoglobin A1C. Have you ever heard of this one? This is usually a test that is used to follow up, especially those who are on medication and so on. So usually a 7.0% average is like good, a normal amount. Okay, the lesser will be good, like 5.5 to 6.5 is good, but 7% is average. Okay, so these are some kinds of different glucose tests that we do for our body. Any questions?